Hi, welcome to another episode of Talking with Docs. I'm Dr. Paul Zalzal.
And I'm Dr. Brad Wiening.
Today we're going to be discussing the fifth metatarsal fracture.
I broke my foot.
Broke my foot, broke a bone in my foot. Very common. So like we often start these videos, we start with, well, what is the fifth metatarsal?
So, the fifth metatarsal is a long bone on the outside part of your foot. Metatarsal, there are 5 of them, this being your large toe, this is your fifth, and connects kind of the ends of your toes to the rest of your midfoot and your ankle. The fifth bone is probably the one that's most commonly fractured. Often when you roll your ankle, you're running and you trip and fall, or you drop something on your foot.
Turn your ankle like that and break it. Yeah, you can be, I've often seen people say they were just walking along and tripped over nothing, just turned their foot in.
Oh, and then they just try to walk it off because they're embarrassed.
Yeah, especially in a crowded subway. That can be awkward.
For sure. So what happens when you break your foot?
Okay, so you're walking along, trip over nothing, or step in a pothole. And then, like with most orthopedic injuries, the first thing you feel is a lot of pain.
Yeah.
And right on the outside of your foot. That will then be associated with a difficulty or inability to weight bear after. And quickly after that, some swelling, redness.
And then maybe bruising even a couple days later, depending.
Right.
So when you feel like that, then you say, well, something's clearly wrong. I need to be seen. So you go to your family doctor, a walk-in clinic, or possibly the emergency room. And what do they do there for you?
So, like always, we do a history and physical examination. So your doctor will ask you, well, what happened? And you'll say, well, after the 3rd bottle of wine, I was trying to walk down the stairs, missed the last step.
Get you every time, always the last one.
And then physical examination. Basically, when we're looking for fractures, we look for areas of maximal point tenderness. So where we push, if that's where it hurts, if we push on the bone and it hurts right there, then we think, well, hey, maybe there's a fracture there.
So after the physical examination, and you make sure that the skin's okay and the nerves are okay, usually it leads to an x-ray in orthopedics, and the x-ray will show a fracture line.
A break?
Or a crack.
They're all the same. A fracture, and most commonly with that type of injury, it's a fifth metatarsal fracture. So can you walk this one off?
So that, you know what, that's actually debatable. So potentially you could walk it off, and I guess if you were maybe in a place where you didn't have access to medical care and you walked it off, there's a real chance that it has potential to heal. It may take longer, may not heal properly, but yeah, you potentially could.
Yeah.
However, this is not advised.
No, but some people do treat these in just a rigid shoe. Say, okay, all I need to do is wear a nice rigid shoe, because if you have a rigid soled shoe, you're not going to bend that bone much, so it'll give it a chance to heal. Not my preferred way of treating it.
And there are different kinds of fractures of the fifth metatarsal. Can I see the foot again? So the fracture can be either the proximal part, the midshaft part, or the distal part. There's one fracture of your fifth metatarsal that commonly is referred to as called the Jones fracture, which I usually don't talk about much because it doesn't really change what I do. It's more of a horizontal fracture at the junction between what's called the diaphysis or the shaft and the metaphysis, which is up top. And then on x-ray, the other things that I look at is how much it's displaced, whether it's in a whole bunch of pieces, and those are going to help us decide how long it's going to take for it to heal. So, yeah, treatment options. You said one option potentially is a firm-fitting shoe. What other treatment options are there, Paul?
A short cast boot, really. So it's like a cast or a ski boot that you can put on and take off. It's very rigid, so it'll protect that bone. When we're trying to get a bone to heal, we want to stop it from moving. So when you walk, if you have a fracture here, this will move. But in a rigid soled shoe or a cast boot, it won't move and it'll give it a chance.
Or even a regular cast, potentially, right?
Even a regular cast, yeah.
And then how long does it take?
Magic number in orthopedics is about 6 weeks.
6 weeks. Yeah, so you'll come back to the fracture clinic, you'll get another x-ray, and you may have come multiple times before then, look at the x-ray, looking to see if there's some new bone growth or if the fracture line is more difficult to see. Are they always healed at 6 weeks?
No. Sometimes they can take longer, 3 months up to sometimes even longer. Have you ever operated on one of these fifth metatarsal fractures?
In 10 years, I've operated on 0.
Okay.
But I think certainly some people do.
Yeah. So there are. I've been at some conferences with surgeons from other countries, and in some countries they operate routinely on this fracture. and certainly some areas might operate on this fracture, or if you're a professional athlete or someone who's it's key to get back to your sport as quickly as possible, they get operated on. But certainly in my practice, and in most of my colleagues' practices, we don't operate on these often unless it doesn't heal.
Right, so the treatment of a non-union. So sometimes the bone will not heal and it has ongoing pain or dysfunction, then that's when you'd certainly consider surgical intervention. Anything else you can do other than surgery to try to help that bone heal?
Yes, I've used ultrasound bone stimulators to help get them to heal,
Yep.
and I've used asked my patients to take vitamin D, oral vitamin D. There's some evidence to show that can help fractures heal.
I tell people to stop smoking too. As a general rule, I
Yeah.
think you should quit smoking anyway, but also to help your bones heal, there's some good evidence to show that it inhibits it.
Butt out.
Butt out. Okay, after you're done, your fracture heals, you get out of the boot, you just go from out of the boot to half marathon?
Yeah, that's my style. No, I mean, it takes a while to get the muscles to strengthen up. Whenever we immobilize a bone for a fracture, we end up getting some muscle loss and atrophy in that area, so your foot will have some atrophy. So certainly you may want to consider some strengthening exercises or even physiotherapy potentially.
I think also exercise for proprioception. I tell my patients that because you're in a boot or a cast, your muscles of balance don't work very well, so you need to get that back. So the last thing we want you to do is to roll your ankle again and break it again and start all over.
Right.
Sports?
Yes, I do enjoy sports. Watching, definitely. When can you get back to sports after a fifth metatarsal fracture?
I tell people 3 to 6 months, no pain, near full range of motion and strength, just like every other broken bone for me.
What about kids? What about pediatric?
I have kids.
Yeah. What about a pediatric fifth metatarsal fracture?
So they're uncommon, but they happen, and they often heal faster than adults. But
Sure.
Same thing, I would want them to have almost no pain and full range of motion.
Yeah, I think I've gotten kids back around the 6-week mark. It depends on the sport too.
Sure.
If you're in a sport where your foot's immobilized, like a ski boot or something like that, then I've had people go back pretty quick to skiing. But if you're like a dancer or Taekwondo, karate, martial arts, where you're barefoot, then those might take a little bit longer to get completely back into those sports with a fifth metatarsal fracture.
Good point.
All right. I think that covers everything about fifth metatarsal fractures that we wanted to talk about.
For sure. Thanks for joining us. If you have any other questions, please feel free to email us at talkingwithdocs@gmail.com.
And remember, you are in charge of your own health.
See you next time.